Oh, I should have warned you about that.
Okay. I felt like an incision just popped.
This is not easy, yo. This shit is so painful. It's just so stressful.
I never had the full ability to have intercourse because the vagina that they make is so small. So anytime I tried to have intercourse, it was extremely painful and it wouldn't happen. So these surgeries are nothing more than plastic surgery. They don't create, the phalluses that they create for female to males are really hideous looking. I've had several female to male friends, and you look at it and you just go, oh God, you paid for that. It's horrible. The sex change didn't solve my discomfort. The doctors who are honest will say that the gender dysphoria is always there.
I started Phalloplasty back in March 2020. I have a fistula, which is an abnormal connection between my urethra and my rectum, meaning the P-tube is pretty much going through my rectum, which is causing ongoing UTIs, urinary tract infections. And so when I had surgery back in July is when they tried to first fix the fistula from going from above. And so that gave me an ostomy bag at age 27. At age 27, I am pooping in a bag. At age 27, I am pooping in a bag. Right. And this past week and a half ago, went back in for another surgery to try to fix the same issue, but this time going through the rectum. And so now after that, I had 2 catheters put in, a Foley and an SP. And the Foley catheter is out. The SP we're still rocking with, sadly, to this day. Now I'm living with these issues.
So I had lower surgery back in January this year. I had some complications that led to this being a scary and painful situation.
This is a popular trans YouTuber, Jamie Dodger, who has over 1 million subscribers on YouTube. Jamie nearly passed away from complications related to bottom surgery, which is surgery to approximate the appearance of male genitalia.
Basically, I had an arterial bleed that required a second surgery to repair. I also had a refilling hematoma that got squeezed twice. Very, very painful thing to have done. And I've basically never been in so much pain in my life, despite having the maximum doses of painkillers that they could possibly give me. And I had to be rushed down for a second emergency exploratory surgery because I was spurting blood from my groin and they weren't sure why. And that's when they found out it was an arterial bleed. And that whole experience has made me terrified to have surgery again. It was a scary experience. Like, I knew about hematomas, but I didn't quite know what would happen if you got one, and I had no idea about the whole spurty arterial blood thingies. I don't know how I'm going to cope with having it again. I really don't. Plus, I need to have each of my implants done separately. That means I need to have at least 2 more, even though I really, desperately just want to feel complete personally in terms of my physical transition. I don't feel ready whatsoever to have surgery again.
So as much as I hate talking about this, the complication that I'm experiencing from RFF, Phalloplasty, post-op, which I am now 10 weeks post-op, I think this is important because it is very common for it to happen to anyone. So if you don't know, I'm a trans guy. I transitioned from female to male, and I just went through bottom surgery, which means my surgeon created a penis down below. The complication that I'm facing is that my surgeon did seal up my vagina, so I had sutures in that area. And at about 2 weeks post-op, those sutures, it's common for it to open because of swelling and just sitting alone. That suture is still slightly open, and just today, it opened a little bit more.
It has been a decade since my sex reassignment surgery.
I had my SRS 10 years ago. It's been almost 4 years since I had the first stage of my vaginoplasty. I had my second SRS revision surgery.
I am getting a second surgery.
After my surgery, I was just in such a dark place that I didn't really want to talk about it. I didn't really want to have to go back into it and feel all those feelings over again.
I had a few complications, bleedings, infections.
I've had complications and I've had a hard time.
I did have some complications and I did have some, concerns that not everybody deals with. I thought it would make me happier. And initially it did. Was that worth the constant issues I've had? The dilation I have to do for the rest of my life?
I'm having the worst time with dilation.
I was experiencing a little bit of dehiscence, which is basically when you are so swollen that the sutures that they put start to rip open. It was as bad as it sounds.
I had trouble urinating. I kind of walked around with it for a year before I sought help.
The reason I'm dilating twice a day is because if I miss once, it is so painful. I dread it so much because it's so painful.
I went to dilate again that night and I think that I moved a stitch. I don't know what happened, but something happened and I was in excruciating pain. It felt like literally somebody had shot me or stabbed me or burned me or something down there.
I had to dilate and I had to try to open my urethra up and it was just yeah, I'm going to start crying.
I was bleeding every time. I literally was going to pass out. I threw up because I had so much pain.
I remember bawling my eyes out saying what did I do? What did I do to myself? I fucked myself up. I'm never going to heal from this.
My body is constantly trying to heal after surgery since it considers it to be an open wound.
I mean, what can I do except go and have another revision?
I remember starting to cry in the surgeon's office because I was I'm depressed and I'm in school. It's painful. It's a lot.
The issues I had very early on should have been indications to me that I should not have done this, but I hated my male self so much that I needed to. And now there's no way to go back.
You can never go back.
When you get a surgery, it's not always going to go well.
If I had known about the irreversible physical damage I caused to my body, then I would have never done any of this.
It's very much a commitment for life. You're going to have to rely on doctors for the rest of your life.
Don't be like me and deny problems until it's too late. Rather, address them so you can be happier and live a healthier life.
Imagine going under the knife, waking up in more pain than you ever felt in your life, and then finding out this was considered a successful surgery. And that's not an exaggeration. According to a 2022 meta-analysis covering over 1,700 phalloplasty patients, the overall complication rate for this procedure is 76.5%. Read that again. 3 out of 4 people who get this surgery experience a complication of some kind. Infections, fistulas, strictures, implant failures, wounds that just don't close. And on the vaginoplasty side, research shows vaginal stenosis alone affects somewhere between 7% and 14% of patients, with voiding dysfunction reported in nearly half of subsurveyed groups. And these aren't fringe numbers from some anti-trans blog. These are peer-reviewed statistics published in urology and plastic surgery journals, the same journals surgeons themselves read. So today, we're looking at a wave of videos that's been quietly building across TikTok. Trans men and trans women, months and sometimes years post-op, sitting in front of a camera and describing what actually happened to their bodies after gender-affirming bottom surgery, fistulas, catheters, emergency surgeries, dilation routines so painful, people describe crying through them, implants that pushed through the skin, infections that wouldn't clear for months. Before we get into it, let's set the stage because context matters here. Gender-affirming bottom surgery, phalloplasty for trans men, vaginoplasty for trans women, is major reconstructive surgery. It's not one operation. It's often a series of operations spread out over a year or more because surgeons frequently build the procedure in stages. First the initial construction, then urethral lengthening, then implants, then revisions if something doesn't heal right. Every one of those stages carries its own risk of complications. The complications people describe aren't rare edge cases dreamed up to scare anyone. They are the same complications that show up over and over in clinical literature. Urethral fistulas, abnormal connections that let urine leak where it shouldn't, occurring in anywhere from 17% to 75% of phalloplasty patients, depending on the technique and study. Wound dehiscence, where incisions reopen under swelling or infection, hematomas, catheter complications, and for many patients, the need for lifelong maintenance, daily or twice daily vaginal dilation for a full year post-op being the clearest example that itself becomes a significant physical and emotional burden. But tension, high complication rates, and high satisfaction rates existing in the same body of research is part of what makes this such a complicated conversation, and part of why it doesn't reduce to a simple it works or it doesn't. The creators you're about to hear from aren't saying surgery is worthless. Some of them say that they don't regret transitioning, What they are describing is something narrower and in a lot of ways more useful. The gap between what they are told to expect going in and what actually happened to their bodies once they were on the table. Because after these clips, we're going to dig into why this gap exists in the first place. And it's not the reason most people on either side of this debate assume it is. Let's watch.
So y'all, I have not spoken to y'all probably since like March or whatever. So yeah, I'm gonna just give y'all a whole month of a rundown because as y'all know, I had AOT phalloplasty, and ever since then I've been having like literally straight complications every week. I've had a total of 4 surgeries, 2 emergency surgeries and 2 of them scheduled surgeries. I recently just had my 4th emergency, 4th surgery as in 2 days ago, and that one is 1 out of 2 of the emergency ones, and I just got released from the hospital today. Right. So yeah, so I'm gonna give y'all a little rundown. So as you guys know, I had surgery March 7th. Okay. You guys also knew that I had to go to rehab after that. So I had surgery March 7th. I got released, I think March 15th. I got released to rehab because I was going to start treatment there, learn how to rewalk and all that extra shit. Right. March 15th got released to rehab. But arriving to rehab, I was only there for 2 days. So I got released Friday. I was only there Friday, Saturday, and then Sunday I had to go back to the hospital because my groin area where my penis is was like real heavy. It was like real heavy. It like my bladder felt like 20 pounds. So I had to go back to the hospital. Turns out I caught an infection. Don't know how I caught it. They don't know how I caught it because I literally just got out. So yeah, ended up back in the hospital for the infection. That was March 19th. Literally just got released. No, 15, 16, March 17th. Yeah, went back March 17th, and then after that I had surgery. I had to have emergency surgery March 19th to flush out the infection because it was literally just traveling everywhere. Right. Okay, after that I was still in the hospital for a week. I don't remember when I got out because it's been so much shit. I got out a week later. After that, they had me on like 4 or 5 different antibiotics. They couldn't find the right one to treat the infection that I have. And then when they did find the right one, they thought that them flushing it, they got it all out. And then to me being on the antibiotics that they did find that actually worked for me, they had me on it for like 2 to 3 days. And then they released me no antibiotics after that because you have to be on the IV for those ones. So I was on the IV for 2 to 3 days, got out. The infection still never went away. So 2 weeks ago, I had, no, not 2 weeks ago. So then after that, I had to go back to the hospital. Like 4 days later, I had to go to the emergency room because I caught a dehiscence. If you don't know what a dehiscence is, it is separation of your wounds. So basically under my phallus, it's literally open. I can see the insides and I can see the goddamn Foley catheter. Yeah, I can honestly see it. It is literally open. Which they were kind of worried about that because they're like, why the fuck is your shit open like this? But to find out, it's a goddamn infection. My infection was so bad to the point where mind you, I was still swollen from my first surgery. So like I was even all the way healed, like not even close to even being done. So I was still swollen, and then I caught an infection. So literally my like skin under there was just like going, and the infection was causing so much pressure to the point where like it just bursted it open. So then they had to watch me for that. So I was in the hospital again for like I think for another week, and then got out 2 weeks ago. I had to have the suprapubic and Foley catheter changed, which was April 3rd. That is my 3rd surgery that was planned. So changed that. You know, I have like 3 or 4 fistulas and like 4 dehiscents, and during this time, like during all of these weeks, literally I've probably been to the hospital over like literally over 5 times, because the dehiscences, separations of wounds just keep popping up everywhere down there. Yeah. I had to get a biopsy of my scrotum. I had to get a biopsy of my penis. Just it turns out it's the same infection that's still there. Mind you, it's not growing anymore. It's not growing. But it's still there. Like, it's not going away at all. So every time I have a post-op appointment, I have to get tested to see if it's growing. It's just there. So after that planned surgery, I had my plastics post-op appointment for a month later, literally after seeing him the whole month of March. I was on a good stretch. I was healing like beautifully, perfectly fine. Like 2 of the dehiscents are starting to close up. The tip of my penis is going great. So I had my post-op appointment Tuesday with him. There was another dehiscence coming. He took a biopsy, not a biopsy, a culture, like the little Q-tip swab, whatever. He took that, sent it off the lab. Perfectly fine. Sent me home. Cool. He's like, okay, I'll see you in a month. Beautiful. Fine. Cool. Whatever. Y'all, tell me why it's Saturday, Wednesday. Wednesday night, right? I'm literally chilling, relaxing. Tell me why that somehow there was a hole inside of my Foley catheter, y'all. Inside of my Foley catheter. And when I tell y'all that shit sprayed out of that hole, I thought it was piss. Turns out it was the damn balloon. The balloon popped. Shit just squirting out like 15-30 seconds and then it just stopped. So then after that, tell me why Thursday morning, me and my wife, we go to the gym, right? Then after that, I go take a shower. Tell me why when I go take a shower, y'all, I'm washing my face and I look down and my goddamn Foley catheter is on the floor. Just sitting there on the floor, chilling. Why?
I'm about 4 months, a little over 4 months post-op from stage 1 of RFF Phalloplasty. And since pretty much the very beginning, I've been having issues with voiding, with peeing, with my urethra, beginning with the catheters that I had post-op and continuing without the catheters to this. So I did have urethral lengthening done as part of my phalloplasty, but the way it is done with my surgeon in particular is the lengthening of the urethra is not completed in the first stage. So my urethra is technically lengthened right now, but it is left partially disconnected until a later surgery. Actually done like 3 to 6 months after the first surgery, pending any complications. But because of the complications I had and the amount of weeks I spent in the hospital, they just want me to relax and my body to heal and not think about surgery right now, and I'm completely okay with that. But I've had a ton of issues with my new urethra and my bladder and all that. When I was in the hospital for the blood clots, I had a pretty serious UTI, I had a kidney infection, and I also had very large bladder stones all at the same time. I had the perfect urine trifecta, as you will. I was on antibiotics for the UTI and the kidney infections and ended up having to have surgery to remove the bladder stones because they were so large. They would not dissolve on their own, and I would not pass them on their own. And with the symptoms I'm having now and talking to people who have gone for the same surgeon and have had the same sort of urethral disconnection thing going on, I'm fairly certain, or at least kind of hoping, that I might be having issues with bladder stones yet again. And ultrasound is scheduled available this next week to more definitively figure out what's going on. I'm kind of hoping it's bladder stones because I kind of just want like a definitive answer and like a definitive solution, because it kind of sucks living like this. I'm grateful to no longer have catheters on my body, but it just really sucks with the pain sometimes and sometimes not being able to go. And then I'm going to be completely upfront about this. I don't really care if it's embarrassing, but it's just really sucks having to wear underpads all the time because of how bad the leaking is sometimes.
So anyways, the final step of bottom surgery was putting in scrotal implants. And it was supposed to be a very easy step, very easy final stage of surgery. And this weird medical fluke happened where a couple days after surgery, on the left side, not to get too graphic, but like kind of a hole developed in the scrotal tissue and the implant started pushing out of it. And so I did have to go down to Portland today and have my surgeon just take out the implant. The right side's doing fine, but the left side, like, it was just this really weird thing. I was trying to talk to my surgeon. I was like, did I do something wrong? Did I like move too fast? Was I too active? Did I not take care of it? And he said it's nothing I did. He was trying to rack his brain about something he might have done that went wrong, but he hasn't been able to come up with anything other than just like super weird medical fluke, which can happen and it sucks and it's annoying, but there's nothing you can do about it. There is the option to go back later and put in a new implant. I just have had 5 surgeries in the past 14 months and kind of don't have it in me anytime soon.
So I just got diagnosed with vaginal stenosis. If you're confused, hi, I'm Zaya. I'm transgender, and like 8 months ago, I got bottom surgery or gender confirmation surgery. So I had a PP and now I have a vagina. I knew recovery was going to be hard, but nobody tells you that it could be this hard. I was diagnosed with vaginal stenosis, and if you don't know what that is, it's basically when scar tissue gets built up inside of the vaginal canal to the point where it's like extremely tight and uncomfortable. And the thing is, for the first year after getting bottom surgery, you have to dilate your vagina religiously because it's a brand new canal that needs to be kept open religiously for the first year. And now that I have this stenosis, I physically cannot dilate. My vagina still has depth, but it's so tight to the point that it could start to close and form pockets that could lead to infection, which means that I have to get another surgery. I basically just have to get the surgery all over again and get my vagina replaced. And like, it's just so annoying. Bottom surgery is not for the weak, babe. It's not for the weak.
Okay, so what do we actually take from that? The first thing worth saying clearly, none of what you just watched is unusual or fabricated for views. Every complication mentioned, fistulas, dehiscence, stenosis, infection, catheter failure, implant extrusion, shows up repeatedly in the peer-reviewed surgical literature at rates that would be considered alarming for almost any other elective procedure. If a knee replacement had a 76% complication rate, that would be front-page medical news. The fact that bottom surgery carries similar numbers and isn't widely known outside trans communities and surgical journals is, on its own, worth sitting with. But here's where it gets genuinely two-sided, and where most commentary on this topic goes wrong by picking a side too early. The perspective that a lot of creators are pushing forward is that patients are being given a full, honest picture before they consent. That informed consent, as it's practiced in a lot of gender clinics, focuses heavily on the psychological benefits of surgery and comparatively lightly on the statistical reality of complication rates, the likelihood of needing multiple revision surgeries, and the fact that some complications, like the kind of fistulas and scarring described in these clips, can be permanent or require lifelong management. Several people in these clips said version of the same thing. They knew surgery had risks. In the abstract, the way you know any surgery has risks, they didn't know the risk was closer to expect this to happen than this could happen. Also, it's just as real and just as documented. This surgery is reconstructive microsurgery performed on tissue that wasn't designed for its new function, and complexity of that magnitude comes with complexity of outcome. That's true of reconstructive surgery generally, not something unique to gender affirming care. Surgeons performing phalloplasty and vaginoplasty aren't hiding a secret failure rate. Many of them publish these numbers themselves, which is where a lot of the statistics come from in the first place. And regardless of which side you support, there's a practical takeaway that applies to anyone actually considering this surgery right now, today, before any policy changes catches up. The published numbers we've been citing this whole video are publicly available. They're not locked behind some medical gatekeeper. Anyone considering phalloplasty or vaginoplasty can look up the actual complication rates for the specific technique and even the specific surgeon they're considering, read patient forums and long-term follow-up accounts, and ask their surgeon direct questions about revision rates before they even get near the consent form. And that's not a substitute for surgeons doing a better job of disclosure. It's just an acknowledgement that in a field where standards vary a lot from clinic to clinic, Doing your own homework going in is one of the few things a patient can fully control. Going in with realistic expectations, knowing that a fistula or a revision surgery is a common outcome, seems to be the difference between the patients in these videos who are angry and blindsided and the ones who are frustrated but say some version of, "I knew this was a possibility." So where does that leave the actual disagreement? Not really about whether complications happen, and that's not in dispute. The data is the data. It's about what should happen next, and there are a few different defensible answers floating around. A few people argue the standard of informed consent needs to change, that patients should be shown the actual published complication rates in plain numbers before they sign anything, the same way you'd be shown survival and complication statistics before, say, a major cardiac procedure. Some surgical programs already do this rigorously. Others, by patient accounts, do it more loosely. Other people argue the deeper problem isn't consent, it's access to aftercare, that a lot of the horror stories aren't really about the initial decision to have surgery. They're about what happens when a patient develops a complication and then struggles to get timely, competent follow-up treatment, sometimes because of insurance barriers, sometimes because there are relatively few surgeons in the world with deep experience in these specific procedures, which creates long waits for revision surgery exactly when someone is in crisis. A third position, held by some clinicians and patients both, is that the complication rates themselves need to come down through better surgical technique and more surgeons getting more reps, pointing to research showing newer urethral lengthening methods have measurably lower fistula rates than older ones. On this view, the story isn't really about consent or access at all. It's about a relatively young field of reconstructive surgery still maturing. The creators in these clips, for the most part, weren't making a political argument. They were describing what happened to their bodies, and what happened to their bodies is consistent with what surgeons and researchers already know and have published. It's just information that doesn't usually reach the public until someone experiences it firsthand and decides to film it. The honest takeaway isn't surgery good or surgery bad. It's that a genuinely high-stakes, high-complication surgical field is having its complication rates surface publicly for the first time in a widely visible way through patient video diaries instead of academic journals. And that gap between where the information used to live and where it lives now is arguably the real story here, more than any individual case.
And I'm gonna stand on this. Just because I don't want to cut off my Glock 9 does not mean I am not a trans woman. But also, what's hilarious is just because you went and got bottom surgery does not mean you are a female. You are a woman, but you are not a female. If you cannot comprehend that sentence.
If you made it this far, I appreciate you watching. Let me know what you think in the comments. If you enjoyed the video, don't forget to leave a like and subscribe for more content like this. Creators' handles are in the description box below. I'll see you in the next one. Bye.